Artificial respiration, or rescue breathing, is the process of providing air to a person who is not breathing or struggling to breathe. It helps maintain necessary gas exchange in the body. When performing this, it is recommended to use a barrier, such as a pocket mask, to reduce the risk of cross-infection.
Artificial respiration simulates natural breathing to support pulmonary ventilation. It is essential when a patient's own respiratory effort is insufficient, often as part of cardiopulmonary resuscitation, or CPR. It can be performed by manual insufflation, where a rescuer provides breath to the patient.
Artificial respiration is a core component of CPR, but can also be performed independently in specific situations, such as near drowning or opiate overdoses. While health professionals often manage respiration separately, lay rescuers are generally advised to perform full CPR. Effective airway management is crucial for any method used.
There are different methods for delivering rescue breaths. Mouth-to-mouth involves creating a seal with the patient's mouth to blow air in. Mouth-to-nose may be necessary in specific cases, such as when there are facial injuries, if the rescue is happening in water, or if the mouth is obstructed.
You might wonder about the efficiency of rescue breathing. Atmospheric air contains about 21% oxygen. When we exhale, our breath still contains about 17% oxygen. This means there is plenty of residual oxygen available to help keep a patient's cells supplied during emergency resuscitation. Sudden cardiac arrest is a leading cause of death globally. When the heart stops, the brain can only survive without oxygen for about 4 minutes before permanent damage may occur. Since emergency services can take longer to arrive, knowing how to perform CPR can be life-saving.
Currently, I am unable to generate audio from content that exhibits aggressive speech language. Feel free to resubmit your text, and I will generate audio according to the guidelines I have been given. Acting quickly is vital. Within 4 minutes of cardiac arrest, brain damage is unlikely if CPR is started. However, the risk of brain damage increases significantly after 4 minutes, and by 10 minutes, brain death is probable. CPR provides the oxygenated blood needed to extend those critical minutes. During cardiac arrest, the heart may stop beating effectively, preventing oxygen from circulating through the body. This quickly leads to cell and tissue damage. CPR acts as an artificial heart and respirator, mechanically circulating blood and oxygen throughout the body to sustain life until help arrives. While CPR does not guarantee survival, starting it within 4 minutes of cardiac arrest greatly improves a victim's chances. To help remember the necessary steps, the system follows the ABC rule: airway, breathing, and circulation. Calling for emergency help is a critical step. If others are present, have them call immediately. If you are alone with an adult, call for help before starting CPR. If you are with a child, perform CPR for 1 minute before calling for help. Always provide your location and the victim's condition. These CPR guidelines apply to adults and children over 8 years old. Always check for responsiveness first. If you suspect a spinal or neck injury, do not move the person. Otherwise, gently shake the victim and shout to check for a response. If there is no response, call for help and check the airway. The first step, A for airway, involves ensuring the patient's air passage is clear. If they are unconscious, the tongue is the most common obstruction. You must look, listen, and feel for any signs of breathing to determine if the airway is blocked. To clear the airway, place the victim on their back. Place one hand on their forehead and the other under their chin, gently tilting the head backward. This movement shifts the tongue away from the back of the throat. If they are still not breathing, you must assist them. For the B in breathing, keep the victim's head tilted back and chin lifted. Pinch their nose shut and create a tight seal with your mouth over theirs to deliver rescue breaths. Watch the chest and avoid overinflating the lungs, as this could cause the patient to vomit. After delivering 2 full breaths, allow the victim's lungs to relax. Place your ear near their mouth to listen for exhaled air and watch for the chest to fall. If the victim remains unresponsive, showing no signs of breathing or movement, you must then check their circulation.
The C stands for circulation.
To determine if the heart is beating, locate the carotid artery by placing 2 fingertips in the depression between the windpipe and the neck muscles. Apply slight pressure for a few seconds. If you cannot detect a pulse, the heart is not beating, and you must begin chest compressions.
When performing chest compressions, hand placement is vital. Use your fingers to locate the sternum where the lower ribs meet. Then place the heel of your other hand next to your fingers. Interlace your hands, lock your elbows, and use your body weight to compress the chest 1.5 to 2 inches deep. If you hear or feel a slight cracking sound, do not be alarmed, and do not stop. Cracked ribs or damaged cartilage are less critical than a lost life. Simply adjust your pressure and continue. Count aloud as you perform 15 compressions followed by 2 breaths. Repeat this cycle 4 times per minute. After 4 cycles or 1 minute, recheck the victim's carotid pulse and look for signs of consciousness. If there is still no pulse, continue the cycle of 15 compressions and 2 breaths until medical help arrives. If a pulse returns but the victim is not breathing, switch to providing rescue breaths. When the heart is beating but the victim is not breathing, administer 1 rescue breath every 5 seconds. Remember to pinch the nose to prevent air from escaping. After each breath, wait 5 seconds to see if the victim begins breathing on their own. If not, deliver another rescue breath. This video provides essential guidelines for responding to an emergency where an adult is unresponsive. Remember that the priority is to maintain oxygenation until professional medical responders can take over. Your quick action and adherence to these steps can significantly increase the chances of survival.
Throughout the process, remain calm and focused on your technique. Proper hand placement and rhythm during chest compressions are as important as ensuring a clear airway for breaths. Do not hesitate to seek assistance from anyone nearby to help call emergency services while you perform life-saving measures.
In any high-stress emergency situation, it is easy to lose count or rhythm. Keep your movements steady and consistent. The goal is to provide continuous support to the vital organs, specifically the brain and heart, until more advanced life support becomes available. If you are alone, the sequence of calling for help and starting CPR is essential. Do not delay these actions. Every second counts when a person is in cardiac arrest, and the systematic approach outlined in this video is designed to maximize the effectiveness of your efforts.
Remember, this information is for educational purposes. Training in a certified CPR course is highly recommended to gain hands-on experience with these techniques under the guidance of a qualified instructor. Practical skill drills are invaluable for building the confidence needed to act in a real emergency.
The techniques discussed, from checking responsiveness to performing chest compressions, form the foundation of basic life support. By mastering these skills, you become better prepared to contribute to the chain of survival for those experiencing sudden cardiac arrest or other life-threatening respiratory issues. Always prioritize your own safety when responding to an emergency. Assess the scene for hazards before approaching the victim. If the environment is unsafe, wait for professional help or take appropriate precautions to ensure you do not become a secondary victim yourself. After the emergency situation concludes, consider speaking with healthcare professionals or counseling services if you were involved in a traumatic event. It is normal to feel significant stress or emotional impact after providing emergency care to someone in need. Thank you for viewing this video. Staying informed and practicing these life-saving skills can make a significant difference. Continue to refresh your knowledge regularly, as guidelines may evolve to reflect the latest medical research and best practices in emergency care. This concludes our review of first aid procedures. Always ensure your knowledge is current by periodically consulting official health and safety guidelines. Preparedness is the key to providing effective assistance when an emergency occurs.